And welcome back to Body Beautiful. I'm Janelle Marie. Today we are talking with plastic surgeon Dr. Joseph Mealy about all kinds of procedures. Last one is otoplasty, and I don't know, what is otoplasty? Ear pinning.
So it's for
That's so much
prominent
easier.
ears that stick out. We're trying to bring them back so they're not as noticeable.
It's a huge deal for a lot of people, the
It does.
ear
It
pinning.
bothers a lot of folks, and it affects hairstyle. Some people don't want to have short hair or wear their hair up because they feel their ears stick out.
And how young can somebody come in for ear pinning?
5 years old is the youngest.
Yeah,
and that's because our ears are 85% their adult size by the time we're 5.
Oh, I didn't know
But if it's
that.
a 5-year-old and their parents bring them in, I still want the kid to be bothered by it.
Yes,
If
absolutely
it's not bothering them, just
true.
wait till it does.
Good point.
It may never.
It may never, you're right. Let's go to the first picture.
Sure. So this is a young woman whose ears stick out mostly at the top.
Absolutely.
So what I've done is just bring them back in closer to her head. They're perfectly formed ears, totally normal. They're just
Really?
poking out.
And so it doesn't affect your hearing. You're not coming in because you can't
does
hear.
not.
It's just coming in because it's sticking
No,
out.
and I have people ask because it's sticking out, like, will I hear less when it's back?
Yeah.
It doesn't seem to matter.
It doesn't
They still
affect your
hear well.
hearing once you get the
Yeah.
procedure. So the first
So
picture,
the
we
first
got
picture
her
has
hair
her with
down.
her hair down.
Second picture,
or
she's
actually
holding it up.
has her hair up, and you can't see her
Oh,
ears
yeah.
anymore. And the next one, she's got her hair all the way up, so we
Right.
can see where her ears are. They're still there.
That is, you can see that's a huge difference between the before and after. Because
And she's very comfortable.
yeah, oh yeah. And for young women, that's a big deal. Men too, right? A lot of men
Men
come
too,
in.
because we tend to have shorter hair. So
that's
our
true.
ears are more noticeable when they stick out.
That's our second picture. There's a man.
So this is a gentleman, ears are coming out. He has kind of different shaped ears, different size, not only the outside, but the part that catches the sound is a little different, makes it more challenging. So what I've done is remove a little bit of the cartilage, bring the ear back, and then also reshape the ear to bend, have it bend a little bit more so it's
love that.
flatter to the head.
Can't see the scars.
Nope, scars are right there. They're right behind the ear.
And what's your downtime on otoplasty?
They're wrapped up for a week.
Real- oh, so you've got something around your head
I do
for a
like to keep
week?
it wrapped up for the week. That way
Really?
they stay in. It's less likely to come back.
So no working out for a week, you know, no.
Yeah, no bending over, stooping, straining. But again, it hurts the first couple of days. By the end of the week, feels normal.
Can insurance cover otoplasty since it is kind of a
I haven't seen them cover that
no,
one.
yeah, it
No.
doesn't seem like, unless
They
you have a
feel it's
real problem with
cosmetic.
your, it's all cosmetic. And how do you sleep after you've gotten the
So
surgery?
you've got the wrap on, so you can sleep however you like.
So it's
It
okay if you
protects it,
sleep on
yeah.
the side and all that?
That's the main reason to have that.
Yeah, that's true, because that'll feel better when you sleep.
Because you don't want them folding forwards. So- so-
Okay. So that's why you're wrapped, because you don't want them folding forward.
Right, because if you're sleeping and you fold your forwards, it
I
may pull
gotcha.
a stitch, cause bleeding, cause problems, so we just need it protected.
Last picture.
So last patient has just one ear that bothers her.
Oh, yeah, that's
So
right.
just the right ear was sticking out, so what I've done is just try to match the left one.
I love that. And so it's a
So
beautiful,
half the recovery.
beautiful before and after.
Yeah, and less uncomfortable when we only have to do one, but it's unusual. Usually both ears stick out.
And we were talking about eyelids the earlier one. I just wanted to mention men do come in for eyelid surgery too, a lot of men.
Sure.
Just wanted to mention that before we went.
Men do eyelid surgery, ear surgery, noses,
A lot of men coming in.
and of course their breast reductions.
And the holidays around the corner, so happy holidays. Thank you so much for coming in. Unfortunately, we're out of time.
Always goes
Oh,
fast.
I know it goes so fast. So if you want more information, just call the doctor at his office. What's that number? 925?
943-6353.
Or go to sanfranciscobreast.com or drmealy.com. See you next time.
Thank you, Janelle.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.